just say thank you to everybody who is here and taking time out of your busy day to kind of talk through and learn more about insomnia and mental health. I'm your host. My name is Dan Larrazabal, and I will be guiding you today through some information on sleep, its benefits, its drawbacks if we're not getting it, and hopefully at the conclusion of this, you will leave the webinar with some new information. So without further delaying anything, let's dive in and get started. So again, my name is Dan, and I'm a therapist at MedPsych Behavioral Health. We have offices in Ramsey, Ultapan, and we are opening up a brand new location in Glen Rock. So stay tuned for that, as well as Montclair. We offer psychiatry, therapy, testing services for ADHD and autism. And one of the cool things about MedPsych is that the psychiatry team, which consists of not only board certified psychiatrists, but as well as physician's assistants, work directly with the therapists when we have a mutual case working together. So we definitely believe in holistic collaborative care, and it really just proves to be very helpful in the long term for the success of our patients that we come across. A little bit about me. I graduated from Rutgers University in 2020, right in the middle of the pandemic, with my master's in social work. Currently, I'm a licensed clinical social worker in the state of New Jersey. Prior to coming to MedPsych, though, I worked at a drug rehabilitation center in Paterson, New Jersey, as well as a psychiatric facility in Summit, New Jersey. So a lot of my work over the years has been with dual diagnosis patients, adults primarily, and utilizing different modalities such as cognitive behavioral therapy, motivational interviewing, and since a lot of people with addiction have trauma, definitely using trauma-informed care as well, along with dialectical behavioral therapy. So just a side note, this is a very important topic to me, not only because of its relevancy for all of us, but having personally struggled with insomnia for about 7 years, I want to shed light on the importance of sleep for our overall well-being. It is definitely part of the, if we want to call it the trinity of health. And I'm just so excited to be able to present this information to you, so that we all can continue to improve in our sleep habits and maybe even make some drastic changes to it. So let's move on. This is obviously a very vague number, 1/3, but take a moment to kind of think about what this number could possibly mean. Let's see if you got it right. So 1/3 of our lives are spent asleep. 1/3 of our total lives for the average person spends asleep. That's a very, very big number. So obviously all of us live to different ages. So for somebody living for 75 years, for that average person, they're sleeping about 25 years. And it's not to say that everybody sleeps exactly 1/3. Some will average a little bit less. Some will average a little bit more, because some of us need more sleep than others. The next number, 50%. What could this possibly mean? Well, 50% of adults in the United States complain of difficulty sleeping. Right now, in terms of overall population, I think the United States is roughly at 335 million. So potentially up to 168, 170 million people in the United States are complaining of difficulty sleeping. That's a massive number. And 70 million roughly of these people are struggling with what we call chronic sleeplessness, otherwise known as chronic insomnia. And just to get an idea of what that looks like, California's current census is at 38 million and Texas is at 30 million. So it's just an astounding number of people who are finding it incredibly difficult to sleep. So this should be at the top of the list in terms of things that need to be addressed moving forward. One thing I want to say before I continue along is that I am just trying to inform. I am not telling you that you absolutely need to change things. I'm going to give you the science behind things, some very legitimate reasons as to maybe why you should consider it. But please, at the end of the day, make an informed decision for yourself as you consider the things that we're going to be talking about. So, what is insomnia? There are 3 primary criteria. The first is difficulty falling asleep. The second is challenges maintaining sleep. And the third is an inability to fall back asleep after an early morning wake up. Personally, for me, it was the inability to fall back to sleep after early morning wake ups. So sleep onset, the ability to get to sleep quickly, not a big issue, but frequent awakenings for me were it was extremely challenging. Insomnia is defined as difficulty initiating sleep, like I said before, with sleep onset insomnia, or maintaining sleep, so sleep maintenance, while also sleeping less than 6 hours for a month or longer with daytime impairment. So if somebody is sleeping 6 hours, but they're not reporting any daytime impairment, then they're not suffering from insomnia, which goes back to the point that I said before that everybody needs varying degrees of sleep. So just something to keep in mind. Sleep researchers define sleep onset insomnia as requiring an average of at least 30 minutes or so to fall asleep. Maybe some of you who are listening right now, you're like, it takes me an hour. It takes me 2 hours, Dan. Some may also say, Dan, when I hit the pillow, I'm out within 2 minutes. So again, we all function a little bit differently, but this is kind of the number in terms of getting to bed. So in terms of sleep maintenance, it's defined as lying awake during the night after initially falling asleep for an average of at least 30 minutes. So you're there, you wake up, and the first 5 minutes goes by, nothing to worry about. 10 minutes, 15 minutes, 30. Now we're pushing 30 minutes, and now the anxiety potentially kicks in of like, I'm not getting back to sleep. I have to be up in X amount of hours, such and such. So yeah, in terms of sleep maintenance, this is what it's defined as. In order to make a clinical diagnosis of insomnia, it's not merely how long one lies awake or the quantity of the sleep, but we also have to take in the consequences from the disturbed sleep that extend into the day. So moving forward, what are the effects of sleeplessness? And just so you guys know, I'm kind of interchangeably using the word sleeplessness and insomnia because I'm sure that there's some in this room that may suffer from insomnia once a week or twice a week. Others may average it 6 days a week. That's obviously a big discrepancy, but nonetheless, we can still experience these kind of symptoms that you see in front of you. And I know that some of these are kind of funny, at least they are to me. You have Jim Halpert falling asleep during a meeting. You have an athlete from Italy competing at the Olympics who's concentrating, but when we lose sleep, we have difficulty concentrating. Stanley in the top right-hand corner, another person from the office, is taking too long of a nap, which we'll talk about later on in the webinar, which then contributes to the lack of sleep during the nighttime hours. SpongeBob being wide awake during the night. Maybe we experience some panic, some anxiety, because the less sleep that we're getting, the more prone we are to other mental health symptoms, such as anxiety or depression. And maybe some of us are just so irritable, like this character from Inside and Out. So this is just a few of the symptoms. Other ones may include declining work or school performance, memory lapses, spending more time in bed, ruminating, muscle aches, headaches, maybe even stomach problems. One thing that's not on the screen that I really want to touch on is the effect of sleeplessness on driving. It's a very serious topic. And in his book, Why We Sleep, it's a very great book. I would recommend it to anybody in terms of understanding the biological arguments for sleep. Matthew Walker noted a study that was done in 2016 by AAA. So they kept track of about 7,000 drivers over a 2-year period. And the study showed that driving on less than 5 hours of sleep equated to increase the risk of car crashes by 3 times. You think that's a large number? Well, let's jump to 4 hours or less. That then moves to 11 and a half times more likely to get in a car crash. So this is primarily because when we're not sleeping and we're at the wheel, we can experience what we call micro sleeps. And micro sleeps are just kind of when have our hands on the wheel and we maybe nod off for a second, or we nod off for more than a second. And it's far more dangerous in a lot of instances for a tired driver to be behind the wheel than somebody who's even had alcohol, because there is no awareness. There's a lack of awareness definitely with alcohol drinking, but if you're nodding off, you're in a 1-ton, as Matthew Walker described it, a 1-ton missile with no control. So the message with all of this is we need to get sleep. It's not a luxury, it's a necessity. And drowsy driving is dangerous for everyone around us. So take care, guys, because this can not only affect you, but it can definitely have an effect on other people on the road. And we already live in New Jersey where the roads are crazy enough. So we definitely need to take more care with these things. We talked about some of the detriments, but what are the benefits of sleep? This is great stuff to focus on. The first, it enriches our ability to learn, memorize, and make logical decisions. A lot of good study habits say to sit down, memorize, or study for a test, and then getting a good night's rest will seal that information in our brains. And also in the same way, we tend to have a capacity to make unwise or illogical decisions when we're running on low sleep. So that's number one. Number two, it recalibrates our emotional brain circuits. Ever felt moody after a poor night of sleep? I know I have. Maybe a little less wherewithal or ability to kind of weather those negative feelings that we're having. And getting a good night's sleep will definitely make us more able to deal with ourselves and our emotions in real time. Number three, it makes us more creative. And four, it regulates our appetite. When I wasn't sleeping, I would commonly get out of bed and maybe go and either have a full-blown meal or be snacking. So there is a risk for people who aren't sleeping to gain weight. That is definitely a risk of not sleeping. But the benefits of a good night rest is that we're not eating in those early morning hours when really, in fact, um, we should be resting and rejuvenating ourselves. So what else? It protects us from viruses and diseases. It lowers the risk of heart attacks and strokes. And as we touched on before, it mitigates depression and anxiety. Um, High blood pressure. We're going to talk about a case example in a little while about somebody who had AFib. These things, having anxiety can definitely be detrimental to our physical health. But also we want to give our body enough time to rest, because if not, our immune system is potentially being compromised. I don't know if you've ever gotten less sleep on a particular night, but maybe you were around somebody who was sick. You're more susceptible perhaps to get that cold or to get that whatever that person had, because you're not well rested. So moving on, how do we personally deal with insomnia? These three are not exhaustive, but I think for a lot of us, maybe one of them fits the description. So let's first start off with caffeine. Oh, caffeine, good old caffeine. Maybe some of you are thinking that you are unable to survive without caffeine. What are its effects on sleep? One, caffeine has a half-life of 5 to 7 hours. Whenever we're talking about half-life, we're talking about the amount of time that it takes your body to eliminate the caffeine from from your body. So, for instance, let's say you have a coffee at 8 o'clock at night with your chocolate mousse cake or whatever dessert you fancy. Um, it is that, excuse me, half of that caffeine is still going to potentially be in your system at 2 a.m. So then ask yourself, how is that helping me sleep? Your brain is stimulated. Caffeine is a stimulant. And I might go as far as to say that caffeine is a drug in of itself. So the desire to have coffee at night is blocking the adenosine. Adenosine is a chemical that is produced in our body that promotes sleep pressure. Sleep pressure is a good thing. It's driving us to become tired. So at the time of our regular, bedtime, we're out. We're out like a light, and we're getting the sleep that we need. So the caffeine hops onto the receptors. I want you to think of it as like a Lego. Um, you have a flat Lego and you put a piece of another Lego on top of it and it sticks there. That's basically what caffeine does. It blocks the normal adenosine receptors, and then it leads to tricking your brain into thinking that it's awake. So some of you might be like, oh, I drink 3 to 4 cups of coffee a day. Okay. Um, but even though I'm able to drink coffee at 8 o'clock, I have no problem falling asleep. Guys, I'm not arguing with you. I believe that. I know people that are like that. But here's the thing. You may not be getting as restful of sleep if you drink that coffee 30 minutes before you go to bed, because your brain is working and your body is working to process the caffeine that's within your system. So I think I can make the argument that your sleep could be more restful, and therefore you wouldn't need as much caffeine to get through the day. Let me take a step back. I know that some of us love coffee, or caffeine in general. So I'm not saying cut out the caffeine. Enjoy your cup of coffee. But if you want to know maybe potentially when to stop drinking coffee, if you're somebody that goes to bed between 10 to 11:30, sorry guys, you should probably stop drinking coffee between 10 to 12 p.m. 10 a.m. to 12 p.m. And there are other alternatives though that I want to highlight. So drip coffee contains a high level of caffeine, but decaf coffee doesn't. And you might say, well, damn, it doesn't taste the same. Well, that's up to you, right? Decide what's worth it to you. I'm not a coffee connoisseur, so can't tell you whether I think decaf or regular tastes different. But if you look at this chart, it really has like what? Maybe 2 ounces, excuse me, 2 milligrams of caffeine in it. Black tea versus decaffeinated tea, even less. Tea drinkers tend to get better sleep overall than coffee drinkers. Maybe some of us love soda. Pepsi. Actually, does Pepsi have caffeine in it? I'm not sure. I know Coca-Cola does. Coca-Cola. Mountain Dew for the young people. These can have anywhere from 40 milligrams of caffeine to up close to 60 grams of milligrams of caffeine. Even dark chocolate. Maybe some of you are like, dark chocolate is disgusting. It's nasty. I would never put that in my mouth. Okay, well, milk chocolate still has some level of caffeine in it, although it's far less. And if there's anybody in this room that just loves the energy drinks, they love the Monster, the Rockstar. I don't know what else is out on the market these days. The chart shows 8 ounces, but in actuality, energy drinks are a full serving is 16 ounces. So you could be downing up to 150 milligrams of caffeine in one shot. And boy, you're going to feel good. Maybe, I don't know, 5 minutes, 10 minutes after you start drinking that, but it's going to be in your system for a long time. So that's caffeine. What about alcohol? America's nightcap. Oh yeah, I just had a day at work and I'm gonna enjoy a nice glass of wine after dinner and I'm just gonna chill out. Okay. Red wine is good, white wine is good. Maybe some of you even like rosé. Um, Low amounts on your screen, you can see this. Low amounts of alcohol decrease sleep quality by 9.3%. Oh, Dan, that's not that big of a deal. Okay. Well, just know that it's less than 2 drinks for men and less than 1 drink for women. Well, what about moderate amounts? This is where we start to get into some higher territory. About 2 drinks for men, 1 drink for women, decrease sleep efficiency or quality by 24%. That's a quarter. That's a lot. And if we're even going more than that, it's Friday night, it's Saturday night, we're going out to the bar, we're gonna have bottomless margaritas. I don't know what it is, but high amounts of alcohol, which is more than 2 drinks for men and more than 1 drink for women, decrease sleep by 39%. Why does it do this? Number one, alcohol sedates you out of wakefulness, just like caffeine, and other things that we'll discuss. Alcohol doesn't influence natural sleep. It actually influences our electrical brain waves. And to compare it, I don't know if any of you have ever maybe gotten a root canal or gotten your wisdom teeth pulled, but it's similar to a person being put under light anesthesia. So there's that. Number two, alcohol fragments the sleep by causing numerous brief awakenings during the night. On a good night's rest, guys, we are waking up, I'd say about 6 times a night, but we're not aware of it. We're just phasing into different stages of sleep, which may be covered in another webinar. But with alcohol, it fragments the sleep. So there's no such thing as continuous. Whereas with the good night's sleep, it is continuous, but we're just phasing in and out of different stages. So you're likely to experience insomnia symptoms and excessive sleepiness because of alcohol. And the important thing to note is that a lot of people don't remember the awakening. So they don't make the link that, oh, I got a poor night of sleep because of alcohol. And then lastly, in terms of alcohol, excuse me, alcohol suppresses REM sleep, which is also known as dream sleep. So it's especially suppressed during the first half or two-thirds of the night. And when our body breaks down the alcohol, um, it produces something called aldehydes. You don't need to remember that, but it produces something called aldehydes, which blocks the brain's ability to produce REM sleep. So pretty much the conclusion is alcohol blocks the brain's ability to produce REM sleep. So even having a moderate consumption of alcohol in the afternoon and evening can deprive oneself of getting that dream sleep, which, and a lot of people will argue, is the second most vital part of the 4 to 5 stages of sleep that we get a night. Let's transition to sleep medication. Maybe there's some in this room that use sleep medication. I'm not coming down on you guys. Everybody is trying to do the best that they can in order to get the sleep that they need. But we should consider whether they are useful for the long term for you. Sleep medications do not produce natural sleep. They don't treat the underlying causes of insomnia, which is really what we're seeking to address. It's just it could potentially be a short-term solution for you to be able to get, I don't know, 4 hours of sleep with that sleep medication that you're taking. But the thing with sleep medication is that it could be potentially life-threatening, especially for those who are older. There's a much higher risk of fall risk for people who are on sleep medication. And even it contributes to what we were talking about earlier with the driving. Because if that drug is in your system, it's affecting you, whether you realize it or not. So we want to be careful in terms of the dosage that we're taking, and we want to be careful in terms of the frequency that we're taking this medication. Really, at the core of it, doctors shouldn't be prescribing more than 2 to 3 weeks of medication at a time. And I can tell you that when I went to my primary, and I think she's a good doctor, so I'm not discounting her, but she gave me a month's worth of Ambien and then a month's worth of trazodone, which are common medications that are used to help address sleep. I only had one positive experience with sleep medication. The rest were not that great. It was the first time I took Ambien and I slept for 10 hours straight. Um, Beyond that, the tolerance developed quickly, and then I started taking more of it and in order to get the same effect, but it wasn't doing it. And I was taking more than what the daily limit should be. So just something to keep in mind. Here's a list of different sleep medications: Valium, Klonopin. Maybe you haven't heard of those. I'm sure that most of you, if not all of you, have heard of Xanax before. Um, Half-life works the same with this as it does with caffeine. It takes time for your body to completely get rid of it out of your body, but some of these medications, they have a very long half-life. So imagine if you're taking one with a longer half-life, but you take it daily, your body is just building and building and building up that tolerance to the point that if you stopped using the medication, you would experience what we call rebound insomnia. This means that your insomnia will be worse than before you started taking the medication, before you prescribed the medication. And it varies from person to person, but it could take weeks for your body to readjust to not being without medication. But here's the concern. You don't want to deal with that, which I totally understand. You don't want to deal with it. You want to be like, you want to be able to get some kind of sleep. So then what do? You go back, you start using the medication again, and you start using it in higher doses, which means that your dependence just continues to go up. So there's some concern there. What about melatonin? We can get the stuff at ShopRite or, Acme, Stop and Shop, wherever you guys shop. Maybe some of you are fancier and shop at Whole Foods or Wegmans. Um, this stuff is so easy to find. Did you know that our body naturally produces it though? It's produced by something called the pineal gland or the pineal gland. I don't think I think you can use either pronunciation of it. But this is this is something that's naturally produced by our bodies, and it's referred to as the hormone of darkness or the vampire hormone. But don't worry, you're not actually a vampire as far as I'm concerned. So, what does it do for us? Melatonin regulates the timing of sleep. So, with that in mind, it has little to no impact on the sleep itself. Matthew Walker, who I quoted before, he talked about it like this. He said that it's pretty much like at a track meet when the referee has the gun in his hand and he says, "Runners on your mark," and the runners get to the starting line, and then the gun goes off. The guy with the gun that's starting the race, that's what melatonin is. So a lot of people probably believe that melatonin aids them in terms of getting good sleep. It doesn't. It just regulates the timing of sleep. The last thing that I want to know is that it's not regulated by the Food and Drug Administration. So, Dan, what in the world does that mean? It means that what's put on the bottle in terms of the milligrams of melatonin may be anywhere, and I'm not joking when I say this, 83% lower than what's actually in that tablet, up to 400 plus percent more than what's said on the bottle. Typically, scientists will say that 0.1 milligrams to 0.3 milligrams, if we're going to take melatonin, is probably the good ballpark. So imagine that you could potentially be taking, I don't know, if the bottle says 2 milligrams for one tablet, you could potentially be taking 10 milligrams, maybe 15 milligrams of melatonin. One time I took melatonin, 2 melatonin tablets, and I can't tell you how much stomach pain I was in. I woke up like 3 hours later and I was writhing in pain because of the melatonin. So also be aware of the fact that it's synthetic. It's produced in the lab. So, we really don't know what is, we really don't know what we're taking. Marijuana, now legal in the great state of New Jersey. How does it affect sleep? So there's two components of marijuana, tetrahydrocannabinol, that's the THC, and then cannabidiol, which is the other part, the more what we view as the therapeutic part. So although the research on CBD is not conclusive like it is for THC, right now we can say that both disrupt sleep. In terms of THC, it speeds up the time it takes to fall asleep, but it blocks REM sleep, which is something that we talked about earlier. So when people stop using marijuana, there is potential for that person to have bizarre dreams. And you say, well, Dan, like, why is that the case? If the marijuana is blocking REM sleep, the brain is unable to make up for, the brain is trying to make up for the REM sleep, but it can cause some very bizarre, strange dreams for people to have. It's very common actually. So that's another side effect of marijuana withdrawal. Like I said, there's not enough research on CBD to show to show whether it really helps with sleep. There was a study that showed low doses of CBD could actually wake somebody up. Um, but whether it's safer or not than THC, we're not really sure. So purity is important as well with this. So now we've covered a lot of stuff. So all right, great, Dan. You told me a bunch of stuff, but how does this get resolved? So here's a potential solution. And by potential, I mean that this is a great solution for a lot of people. It's called CBTI, Cognitive Behavioral Therapy for Insomnia. And CBTI is really cool because it's short, it's structured, it's definitely intensive, but it's an evidence-based approach to fighting insomnia. A little while ago, we were talking about how alcohol or medication, it doesn't treat the underlying causes of insomnia or a poor night of sleep. This does. And it's recommended and being embraced by the medical community as the first line of treatment to deal with insomnia above sleep medications. So as far as the research shows, CBTI doesn't cause any side effects, and it can work in the short term, and it can even work. It works in the long term as well. So the underlying thing with CBTI is that it addresses the behavior and thoughts. I mean, that's what we are as humans. We behave a certain way and we think a certain way. So trying to address that rather than resorting for the long term to a medication in order to try to get the sleep we need is a far better solution, in my opinion. So why? Here's some numbers. 70 to 80% experience improvements in their insomnia. That's a very high number. And out of those 70 to 80%, 85 to 90% reduce or eliminate sleep medication. Remember, guys, I'm not saying that we need to get rid of it completely. If you have some Ambien as a PRN, by that just like maybe as needed, and you're struggling to fall asleep one night, sure, go ahead, take an Ambien. I'm not saying that you can't take one, but if we're able to again induce natural sleep, the sleep that we so desperately need, this is a better option. And it's more effective than sleeping pills. And like I said before, it's short term. So this typically lasts between 6 to 8 weeks. So it's pretty rapid. It is intensive and it requires work on part of the person and a strict protocol. But in terms of thinking about the rest of our life, this is a very short period of time. One thing to note is that some research on CBT also it can help in reducing insomnia in patients with comorbidities, so more than one issue besides sleep. These issues can include pain, fibromyalgia, depression, PTSD, substance use. These are other things that CBTI can be helpful for people that struggle with these kind of things. So even in some studies, it showed that CBTI improved the rates of depression far better than an antidepressant medication. So it's very useful. How does it work? So CBTI focuses on restructuring thoughts, feelings, and behaviors that are contributing to insomnia. Some of you may have the thought of, Man, I only got 4 hours of sleep. My day is going to be awful. Hmm. Maybe. Maybe it will be. Maybe it won't be though. So a core a core tenet of CBTI is challenging those negative thoughts and replacing them with positive sleep thoughts, which is something that's very common with cognitive behavioral therapy itself. Cognitive challenging, cognitive refocusing, cognitive reframing. And CBTI also includes things that could be taught, such as stimulus control, which may be, hey, only use your bedroom for sleep. Don't be in it for other things. Don't watch TV, things like that. And sleep restriction, which is one of the big things with CBTI, which is a hard thing for somebody who's struggling with insomnia to work through. Because basically what you're saying is you're recommending that if the person is only sleeping 3 hours a night, that they only be in bed to 3.5 to 4 hours of the night. And you're telling them that if they're not sleeping, to get out of bed. Obviously, we know our beds to be a very comforting place. In the wintertime, when it's cold out, it's hard for us to get out of those covers. In the summertime, the air condition is maybe blasting in our bedroom, and we just want to stay snuggled up and feel some sense of comfort. So it could be challenging for somebody to be like, well, damn, why would I get out of bed at 4 a.m. when I don't have to be up until 8 a.m.? The thing is that your brain is confusing the bed with both sleep and wakefulness, which is something that we don't want. We want everything around us besides the bedroom to be about wakefulness, but um, but your brain can become confused and it can think of the bed as more than one thing. So that's how it works, at least in part. So how does it look in practice? Negative sleep thoughts, positive sleep thoughts. I won't survive without this cup of caffeine. Positive sleep thought, getting the sleep I need will be more beneficial than this cup of caffeine or coffee. I only got 4 hours of sleep. My day is going to be awful. I have survived nights of insomnia before. I can do it again. Guys, we're resilient and our brain is constantly making up for these deficits. So we're able to get through this stuff. So I want you to leave here thinking this is not without hope. We have plenty of hope. A quick case example, John. John came into me and he was he received a diagnosis from his doctor of AFib 4 weeks prior. During those weeks, he didn't sleep barely anything. He was unable to fall asleep, and if he did fall asleep on a given night, he was only able to sleep for maybe half an hour to an hour at a time. He started taking Xanax 4 consecutive nights, on him to sleep 3 to 4 hours, and he was a mess. He's like, Dan, there's no way that I'm going to make it out of this. And I said, no, John, I think you will. And he's like, you have no idea what I'm experiencing. I'm like, actually, I do. And I went through it for 7 years. So I'm telling you, John, just stick with it. Stick with it, follow the recommendations, and we can get out of this on the other side. So within about 6 weeks after the initial assessment, John was able to improve to 5 hours sleep a night without sleep medication. So you might look at it as a glass half empty with like, well, it's only 5 hours of sleep. It's not what I'm used to. But also the quality of the sleep, which is what we're going for, is really the most important thing. And John's mood just skyrocketed. He was able to go back to work after a leave of absence, and he felt fuller after the fact. So who would benefit from CBTI? Individuals with problems falling asleep and staying asleep, and individuals who wish to reduce or eliminate sleep medications. Anybody here that doesn't have chronic insomnia, you could still benefit from CBTI. You don't have to meet the diagnosis of chronic insomnia in order to benefit from this. So, so yeah, that's just something to know. And I just want to leave you guys with some healthy sleep habits. Um, these are just a few. Get your vitamin D daily. Getting outside is really important. Getting light into our eyes is really important. It resets our circadian rhythm. It helps us get into a state of wakefulness. it tells our brain, all right, it's time to go. So on a clear day, 10 to 15 minutes of sunshine, great. On a cloudy day, 20 to 25 minutes of sunshine, even when it's raining outside right now or wherever you are, um, still get out, even though the weather is yucky outside. Two, give your phone a bedtime. I recommend that you get off your phone or electronics an hour before your bedtime. Try to do something a little more relaxing, listening to music, reading a book, doing a puzzle. I know puzzles are boring for some people, like myself, but if you like it, do it. Exercise earlier in the day. Exercise is really great in terms of improving the quality of our sleep, but we also don't want to do it too close to bedtime because our body is still working on getting all that heat out, and body temperature, especially internal body temperature, is really important for us to get a good night's sleep. So if we're hot, we're waking up and we're sweaty and we're just tossing and turning, and that's not good for us. Don't take naps after 3 p.m. Uh, if so, limit them to 30, maybe tops 45 minutes, because again, we want to increase the sleep pressure. We want to be able to get to our bedtime and be lights out. And if we take an hour, 2 hour nap, 3 hour nap, um, that takes away from the most important sleep that we can get. And lastly, stick to a schedule. Everybody has a different bedtime. People are either night owls or morning birds. I think that's the expression. But stick to it as much as you can. I go to bed at 9:30 pretty much every night, even on Friday nights and Saturdays. But again, checks and balances, live your life, have fun, spend time with your loved ones. That's all important. So just know, just make a mental note in your head. If oh, I'm going to bed at 11:30 tonight. I know that my mood is not going to be good and I'm not going to feel as well rested, but that's okay because this is important. Sleep is not the most important thing um, in terms of like all of our life. It certainly is something that we shouldn't ignore, but also we don't want to be just constantly turning down opportunities to spend time and to do things that we love because we need to get to bed at a specific time. So thank you for your time. Please feel free to submit any questions by typing in the chat box. Let me see here. Um, Excuse me, guys. I'm sorry. At the bottom of your screen, it's there's a chat box and then there's a Q&A box. So if you have any questions, please feel free to put them in the Q&A. Apologies for that. Just know that any questions that you guys do give, I'm the only one seeing them. So don't be afraid to ask a question. Yeah, so while maybe we're waiting for a question or two to come in, what are some typical questions that I get? Dan, do people always improve um, within 6 to 8 weeks? I would say with the majority, uh, I'd say the majority, yes. But again, every person is different. Every person has different obligations. Some might take a little bit longer, and some might be a little bit hesitant to really apply the different things that are being taught to them in session. Um, so it's really, in one sense, self-paced, although the goal is to get sleep under wraps as quickly as possible for the person because, you don't want to necessarily go any longer than you need to. Um, One thing, this is a good question. How beneficial are sleep logs? So that's a very good question because um, if somebody is coming to see me to get their sleep under control, I will give you a sleep log to keep track of your sleep Monday through Sunday. It's very extensive in terms of the questions that it asks, and it helps you as well as me know like the trends that we're seeing on a daily basis and ways that we can tweak things and change things up. So so yes, you if your sleep is kind of out of sorts and you're not really sure when you're falling asleep, how long it's taking you to fall asleep, all that different kind of stuff, then yes, logging it would be beneficial for you. So let's see. I'm getting ready to switch to new hours at my job. I'll be doing morning hours now instead of nighttime, and I am a night owl. What do you recommend to help me get a new sleep schedule? I usually fall asleep around 3 to 4 a.m. Now I'm going to have to wake up at that time to get to my 5 a.m. job. Wow. Um, that's a very good question. Hmm. So I would be curious in terms of what you're doing on a daily basis to kind of help yourself get to sleep. I'm also curious what time your 5 a.m. job ends at. And I'm sure that you probably want to spend time with people that are in your life. So it's like, well, I prefer not to sleep uh, when I get home from work. But yeah, you're a night owl and you're going to bed at 3 to 4 a.m. It usually falls asleep between 3 to 4 a.m. Hmm. Yeah, I think that that question requires a more detailed response and definitely some more information before I can answer that accurately. So I apologize that I can't fully answer it right now. What about menopause and postmenopause with regards to the CBT method? I believe that there are definitely studies in terms of the effects of menopause on sleep. Just so you know, women struggle with insomnia more than men do. Um, so I think the recommendation is still to use the same methods um, of CBTI in order to help with your sleep, even while you're going through that phase of life. Um, but I am personally not aware of any studies that that are that show that show the correlation between menopause and sleep. So, is it possible to change our body clock? Biologically, we're either morning people or night owls. There isn't a whole lot that we can do. I mean, I'm sure over the course of time, if we were used to being awake at a certain time that was different from our biological disposition or chronotype, then your body would become adjusted to that. But I don't think it would fully switch you over from one to the other. So yeah, just another kind of question that was asked before in some kind of way, what about overnight workers? This could be tricky because everybody's chronotype in terms of whether they are a morning person or a night owl will be different. Um, but there needs to be a time when overnight workers are getting the sleep that they need during the daytime. So there are things that we can do in order to get the best sleep that we possibly can. It just may be a harder lot for those that are overnight workers, if they're not, if they're used to if they're used to sleeping during the night into the morning. So the whole idea though is that wakefulness is going to be challenged. So as long as wakefulness is being challenged and the sleep pressure is there, people should be able to get some moderate amount of sleep so that they can then continue in their overnight work and not feel like they're running on fumes. So let me see here. Um, I want to thank everybody for joining today. Thank you for your patience and for bearing with me as we went through a lot of information. Hopefully in the future we can discuss more about kind of the stages of sleep and work through all that biological stuff. But